Okay, we're going to start and kick off this morning, and we're going to talk about Elmo. So Elmo asked a simple question in a tweet in January, and there was internet trauma that was dumped upon our poor little friend. What he did that was really powerful was he started to understand the American psyche and the focus around mental health and wellness. In fact, in a new survey that we ran with Sesame Workshop, 77% of Americans said that investing in mental health and wellness was as important nearly as economic prosperity. So when you think about this, and you also look at another trend that we're studying in work that we did with the APA on what we call crispy parenting, the stress in parents, it is now the data where 20% point differences between parental stress and American stress exists. So much so that the Surgeon General has issued a warning for parents. Why this is so important is that 2/3 of Americans believe I have to be responsible for my health because no one else seems to care. Others are turning to social media. The point is partnerships, and that's what we're going to get into very briefly today. Let's start first about social media. In a new study that we ran with the New York Times, 50% of Gen Z wish that social media hadn't been invented, right? 55% said that they started using social media before they turned 15 years old. They're also attuned to climate change, including the fact that 51% of them have dreamt about it. So these are the stressors that are a part of modern life, but it's not all bad. Let's talk about Jeff Goldblum. A great tweet in Instagram, may we be as cool at 71 years of age as Jeff Goldblum. Well, this, ladies and gentlemen, is the trend that we call at the Harris Poll, boomtastic. There is incredible energy and enthusiasm around boomers in aging and longevity. So much so that 73% of boomers believe that 70 is the new 50. Now, the other part of this that's so encouraging are GLP-1 drugs. We did a recent survey. 56% of millennials have either tried or are willing to try GLP-1. And that's because they are the platform for personal reinvention. Look at this data. When we go through and we see 45% of people that are on GLP-1s are also eating less quality processed foods, reduced cravings for alcohol. It's actually reshaping the resale market. So there's all kinds of other knock-on effects that are starting to emerge from the positive sense of self. Now, the problem is the system isn't providing necessary support in the eyes of the public. Patients want more accessible care. They want greater coordination between providers. They want transparency. They want easier appointments and access to their medical records. But 70% of Americans tell us that the system isn't meeting their needs. In fact, only 10% of Americans give the healthcare system an A. We add in the Bs and we get to 40%. And lastly, 51% directly feel the effects of healthcare worker shortages. We call this the supply chain problem at the doctor's office. So when we think about this and we think about healthcare access, the public is telling us we want partnerships because increasingly healthcare is out of reach. In fact, 44% of Americans have skipped or delayed care in the past 2 years due to cost. Another 51% said they couldn't pay off an unexpected healthcare cost out of pocket, and those extend into retirement, where 2/3 of Americans are greatly concerned about the impact of healthcare costs on their well-being as they retire. Now let's look at gender and race. Incredibly, BIPOC Americans, 55% report receiving poor quality care within the last year. Folks, that's up 11 points from 2022. More than half of BIPOC have sought out a second opinion after feeling that their original healthcare provider dismissed their healthcare concerns. What is incredibly sobering to see is when we ask the question, how much do you agree that the following factors negatively impact the quality of health care you receive, race is a 47-point swing between black and white Americans. This is the world we live in. Plus, with gender, you see that it takes women 3.9 years to get a diagnosis for chronic illness. For men, it's 2.4 years. Now, a lot of this is perceptions, but perceptions are reality. And that's the work that we got to do. Esther talked about the importance of AI. We see it in our data. AI is really exciting both for doctors and for patients, but really it's about people. Look at the data on the right-hand side. In a survey we ran with the AAPA, 92% of Americans say PAs should be allowed to provide quality care to the fullest extent of their education. 91% believe that fully utilizing PAs improves patient health. So yes, it's about the tech, but it's really about the people, the one-to-one communication. So with that, we also have a lot of work to do because Americans are showing intent, but there's a lot they don't know. 81% assume that all health data collected by digital health apps is protected under HIPAA. 71% believe we have the lowest rates of infant mortality. More than half don't understand that heart disease is the leading cause of death in the US. And lastly, 7 out of 10 Americans flunked our quiz on Medicare, as we asked them. So what we really have to do ultimately is focus on partnerships. The intent is there, the excitement is there, the desire is there, but how do we all work together to make greater health outcomes? Because 9 out of 10 Americans say fixing healthcare system requires everyone. It's patients, it's doctors, it's experts. And nearly 9 in 10 are ready to work with their doctors and healthcare professionals to create change in our healthcare. And I think really the solve as we go at this conference for the next 2 days is that 57% of Americans worry there won't be systemic change in our healthcare for many years. Now, underscoring all of this is preventative care, and maybe that's a place for us to start, because both doctors and patients agree we need to shift the health system from treatment to prevention, and that could be a starting point. So we're really excited about today. We want to get you into the discussions, but this is a quick look at the public's view on healthcare, and I wish you a really exciting day today.